Hello, how are you? I'm Michelle Hemingway. I am in Adult Health 1, Section 11, and I'm going to be doing administration of medication via a mini bag. So the first thing I'm going to do is implement my standard protocol. I want to make sure that the doctor's orders match the MAR and that I am working with the correct patient. So I can verify the patient by two identifications. So I'm going to use the patient's name and the patient's date of birth. I want to review what the doctor has given me today. So he has ordered vancomycin 500 milligrams to be infused 100 milliliters per hour. It's my job as the nurse to ensure that I calculate the correct drops per minute. So that is seen here in this calculation. So I have 100 milliliters times a drip factor of 10 over 60 minutes, which comes out to 16.66, which is rounded up to 17 drops per minute. So I'm going to go ahead and apply my gloves and get my medication ready to go. While I'm doing that, vancomycin is typically ordered for patients who have an infection or if the doctor is trying to prevent an infection. So he may order an antibiotic or she may order an antibiotic. As a nurse, it's my responsibility to make sure that I understand that this medication can cause effects such as nephrotoxicity or ototoxicity, so I need to be aware of those signs and symptoms and act accordingly. It is also my responsibility to make sure that the patient has no allergies to vancomycin, which this patient does not. I have already calculated the correct dosage rate, so it's going to be done over 17 drops per minute, which I will set later on after my IV is set and hung. At this time, I'm going to inject my vancomycin into my saline solution bag. So I want to make sure I take an alcohol swab and clean my bag off. I also want to make sure that the vancomycin I'm using has not expired, and it has not. And I also want to make sure that I'm using vancomycin, which I am. I'm going to go ahead and insert this into my bag, my mini bag, recapping the needle using the scoop method. And then now I can go ahead and mix this back and forth, like so. I'm going to do that. I'm not going to shake it because I don't want to create air bubbles. After that, I'm going to go ahead and label this with the patient's name, the drug, the dosage, time of administration, and my initials. So go ahead and have that medication label placed onto the bag. At this time, I can now attach the needleless device and begin hanging my bag. Once again, I want to make sure that I pop the top, clean with alcohol here, and clean with alcohol here. Okay. Now, I can go ahead and get my bag hung. Priming my tubing, about halfway full, making sure that fluid is going to flow through the tube, which it is. Clamping and unclamping. I have a free-flowing fluid, so that is what we want. And then I am going to set this down for the time being while I prepare my 6 milliliters of solution to flush through the patient's IV before inserting the needleless device onto the patient. I again want to make sure that I am working with the correct patient, and I am. And then I want to make sure that I educate the patient on why the medication is being given to them. Okay. So once again, you want to clean the area that you're going to be using, attaching the syringe there. Before I do that, I just want to make sure that I'm palpating around, assessing the site for any infiltration of the fluid, any phlebitis, any erythema, edema that I may see, and also ask the patient if he's had any issues with this IV so far. Alright, so now I'm going to go ahead and aspirate back, ensuring that I do not see blood. And at this time, I will go ahead and flush the IV before connecting the tubing. Alright, so I will disconnect the flush. Then I can go ahead and attach my IV tubing. But before I do that, I want to make sure again that I go and clean, minimizing the risk for infection on both ends. So I can go ahead and get that set up. And then I want to just go ahead and make sure that I calculate how many drops per minute that the patient's going to be receiving. So it's going to be 17 drops per minute, which I will observe here in the IV using the clamp method. So I'm going to clamp and unclamp. And I'm just going to continue to observe for 1 minute, 17 drops per minute, and adjusting accordingly based on how fast or how slow that the drops are coming out of the saline bag. All right. Now, I've established my flow rate, and now I can watch and observe for signs of infiltration, inflammation, any pain that the patient may be having at this point, and apply a new sterile needleless device for administration of the next medication. I'll dispose of any needles and syringes that I have into the sharps container, and then I will monitor the patient again for any swelling, redness, erythema, any adverse effects of the antibiotic being infused. And then as the nurse, I will also want to document this procedure, recording the time, the drug that I was giving, the dose, and the route. I also want to document where I gave the medication, so I gave it in the patient's forearm. And I also want to document the patient's IV site. In this case, it would be clean, dry, and intact. However, sometimes it may be inflamed, irritated, and those are things that as a nurse you would want to document. And then the last thing I want to do is record the volume of fluid on the MAR that was given and the intake and output of the patients. And that's how you do antibiotics. Thank you.